Well, I'm getting on now, I'm thinking about retirement, so I thought one way of easing out gently would be to sell to a corporate, and I felt with a smaller corporate there's going to be a little bit easier access to the guys at the top, and there is. You know, we have good contact with them. You feel part of a team. You're not sort of isolated, but you're allowed to get on with the dentistry the way you always have. So you know, it took a while, a bit of negotiating with Portman Healthcare before I actually signed on the dotted line. And then there was a transition period of about 3 or 4 months where any protocols that Portman wanted to introduce were brought in, and any protocols that we had that we thought were good and they thought were good were kept. But it was relatively seamless, the actual transition from owning the practice to a corporate taking over. From a day-to-day running of the practice and from patients' perception, very few patients actually realise that Portman own the practice. They've got some branded, Portman Healthcare branded brochures and banners and things in the practice. But there's a case today, a lady today for an examination, and she had no idea. I mentioned that I'd sold the practice to Portman 3.5 years ago, and she said, "Oh, have you?" She didn't even know, which I think is a good thing, because you know, patients like their dentist, they like their dental practice, so not sort of changing it dramatically is a good thing, I think. Portman have not said to us, you can't use this material, you can't use these implants. We've just carried on using exactly what we want to. Same with laboratory work as well. We're still allowed to use whatever laboratory we want to, and in fact they've organised a slight discount with our laboratory, so we're getting a slightly better deal on our lab charges. So the support we get has been really good, but we've not really needed it that much. You know, we've just carried on as an individual practice to all intents and purposes. But when we have needed it, particularly with things like Care Quality Commission that they've back up there, and the procedures and protocols that they've done in-house have been good. And you know, just general running the practice, things that I would normally have had to do, such as fire regulations and so on, that's all taken care of by Portman Healthcare. I often get phone calls from prospective acquisitions from other practices, and I've always recommended going ahead with the deal if it sounds like they want to sell. It's a nice small group, so you're still part of a small, relatively small team, and very easy to get on with and very approachable. So yeah, I'd definitely recommend Portman Healthcare.